My name is Richard Burton, and I have ocular melanoma.
My name is Eva Lyford. I'm Richard's wife and have no cancer, fortunately.
I found out in a way that is so banal. I just went for a routine eye exam. My optometrist is very pedantic, and she noticed the freckle on the back of my eye possibly, maybe, might have changed year to year. She sent me to a specialist. He looked, he wasn't sure. He rescheduled me a few months later, and there it was. I had never heard of it before. When my optometrist mentioned it was a possibility, she said, "Don't look it up, it'll scare you, you probably don't have it." I said, okay, but as soon as I hit the door, I got on the phone and I was Googling right away. I was very scared, yes.
I have a background in research, so I tapped upon those skills to investigate all the different options that were out there. We were, I guess, in the game of things, kind of unusually situated that one of the main doctors who led an emergency study on ocular melanoma lived up the street from us. So we were able to get into his clinic pretty quickly. And it was about a 5-day stay in the hospital then.
They'd also taken a biopsy of the tumor to do genetic testing. It was class 2, which means it was the deadly aggressive form. As quickly as it grew, I figured it was. And at that point, we just started looking into all options, and immunotherapy came up. There were, 4 clinical trials in the world at that time?
But we found later that if we had not taken the biopsy at that time, it's almost impossible to harvest tumor cells after the radiation therapy because in the eye, it's a difficult place to go to. So we were fortunate that the doctor was able to present that option to us pretty impartially so we could access that option, get the testing that qualified him for the immunotherapy trial.
It's so rare they don't have data, so there were only 4 clinical trials in the world. And so there was nothing in Indianapolis. We wound up going to MD Anderson in Houston for a variety of reasons. There is a good side to it. 4 years out, I am still not metastatic, which is against the odds. So on my bad days, I remind myself, I'm playing with house money. So I keep that in mind, but it affected me very, very badly. She may be able to speak to it better than I can, but I have really, really bad fatigue. I had to stop working. It's affected my balance. It's affected my emotions. It's affected my memory, I'm a completely different person now.
In terms of the clinical response, I think we've been happy in that he's beaten the odds that are out there for this kind of therapy. I think 78% of folks with class 2 ocular melanoma experienced a death within 5 years. So those were very difficult odds for us to face at first, and we were glad to have the option to be in the trial.
I'll say it's been tough on both of us. I think for me, it's harder to see what she has to deal with than actually go through it myself. Some days I think I've got to do this and push through because I don't want her to have to deal with anything more than I'm dealing with, than she's dealing with already, because I'm already so limited. So I wind up pushing myself too far, which often makes it worse.
Well, I think it's important to realize that some of the language used for describing cancer side effects is similar to everyday language. You might talk about having the flu and missing a day of work or being extremely tired, and it's not the right language for the kind of side effects you get with cancer. It's like comparing a puddle to the Pacific Ocean and saying they're both bodies of water, right? I don't know that there is a better language to describe what goes on with cancer, but don't diminish that the side effects seem like something that's familiar to you because it's a completely new territory.
Sometimes it's very difficult to think about the future because you're just trying to deal with so many issues day to day. I mean, the world does not stop. The kids have to go to school, they have to go to the doctor, things have to get done around the house. And so some days just getting through all that on top of the cancer and the fatigue, you don't think much about it. When I do think about it, I think that I'm going to treasure every little moment I have because I don't know if tomorrow could suddenly change.
I feel like we're starting to get some of our future back. After the diagnosis and for the time that we were going through treatment, it was very difficult to contemplate a future. It's a little tricky now, but we're starting to talk more about longer-term plans and being able to do things with our life.